Good morning. I am 3 weeks, as of yesterday, 3 weeks post-op for mitral valve replacement. I don't have anything new to report. I was getting dizzy. That seems to have stopped. I don't know what my hemoglobin count is. They wanted to do a blood transfusion at the hospital, but I refused it because I almost had enough blood and I just wanted my body to make its own blood. So the dizziness has stopped. My blood pressure, I'm just pulling up this chart I have. It's been anywhere from um, the top number, high 90s to 110, and the low number, high 60s into the low 80s. So that's where it was pre-surgery. So that's like pretty perfect. My scar, let me show you my scar at 3 weeks. Let's see. It's not so bad. Barely a little bump anymore. The bump at the top, I guess everyone gets it because when I asked the nurse what it was, she said everyone gets it because that's where the surgeon starts the cut. So for some reason, I don't know if it's swelling or tissue or what, but everyone gets it. And at 3 weeks, it's almost really like nothing. It's almost like I have like two pennies under my skin or something. That's how low it was, where before it was like a puffy ravioli. Um, I haven't started cardiac rehab or anything. I go back to my regular cardiologist around Valentine's Day for my 2 week or 2.5 month, 2 month follow up. At that appointment, he's going to schedule cardiac rehab. I'm driving and I shouldn't be. Not because of painkillers, but because of the sternotomy. I don't know if I'm saying that right. Your sternum, when it's cut apart, it's not healed yet. So it's like a broken bone waiting to heal back together, I guess. And the problem with driving is if the airbag goes off, if you have an accident, your sternum cannot protect your heart right now. So you have to sit. I'm still sitting, well, I was still sitting in the back seat with the heart pillow between me and the seatbelt. So I was driving yesterday. I've been subbing, and the first day my son drove me. The next day I subbed, I drove myself. And substitute teaching is good because I can walk around the room and I can sit. So, but the first the first sub job I went to on, was it Tuesday? As an art teacher, because that's what my certification is. So when an art teacher job comes up, I grab it. And I was thinking the same thing, that I could walk and sit and rest, etc. So when I got to the school, I was told that there is no art room, that there's an art cart that I have to push from room to room. And I'm thinking, oh no, I'm not supposed to push, pull, or lift more than 6 pounds or 7 pounds or something. So, but I didn't want to say anything because I didn't want, I want a future job at the school, and I don't want them remembering me as, oh, that's that girl that like shouldn't have been at work yet and she came back to work too soon and she's a liability or something. So I didn't want to tell anybody about my situation. So what I did was, after I read the teacher's lesson plans, I actually one by one removed things from the cart that I wasn't going to use, and that made the cart so light that, and the wheels were good and I was able to push it. And then Wednesday when I subbed, it was a fifth grade class, and they were great, really easy class, and I felt good. I walked around, I sat, it was a normal day, and it felt good to be productive and be out at work. So then anyway, I drove myself on Wednesday because the school I could walk, but it's too cold. It's so close. So, and my daughter goes to that school. So I drove to the school, spent the day subbing, got my daughter back in the car after school. I went down the road just a little bit more, and as I'm driving down this road, this pickup truck is coming out of a parking lot onto the road backwards. He's backing onto this road right in front of my car. And I had to hit the brakes and kind of go around him. And it was really a wake-up call. Like, if I would have hit that truck, my airbag would have went off. And I totally should not be driving. So, I'm glad we didn't hit. And I'm just taking that as a warning that I shouldn't be driving. So I'm going to call my surgeon's office to find out when I can drive. When is this sternum healed? Um, should be the same as a broken bone, I would think. Um, what else? I went Christmas shopping yesterday and I took my time. I was in Walmart and I got there at about 10 a.m. Went in their McDonald's, had a, sat and had some breakfast and ordered a coffee. I'm drinking regular caffeinated coffee because the hospital said I could, so I don't overdo it, but I just had my cup of coffee and I just took my time shopping around Walmart with my cup of coffee and getting Christmas presents. And I got my son a winter coat. He's upstairs, so I have to talk quiet. And it's heavy, and it was up on a top rack. So when I got it down, as I was bringing it down, I'm like, ooh, maybe I shouldn't be. I mean, it can't be 10 pounds, but just the fact that I was reaching up and had that weight, maybe it's good, but I knew I was straining myself. Um, so I'm not having dizziness anymore, knock on wood. That seems to have stopped. So when I was shopping, like on my last video a week ago, I said I was squatting and then standing up and I was getting really dizzy. That wasn't happening, and that's not happening in my house anymore. So I think my dizziness has ended. Um, I really don't have anything new to say. I feel great. I feel like I didn't have surgery except for those times that I'm moving a certain way. At nighttime, I'm getting some palpitations. I really feel my heart pounding, especially on my left side. But my pulse has been good. My pulse is down to 85, 86. And it was at the hospital, it was like crazy, like 100 at rest. So um, my cardiologist put me on Natadol, and that's got my pulse right to where it needs to be. So things are looking good. I'm feeling good, and I guess check back. I'll make another video in a week, and or if there's any changes before then, I'll make a video before then. But thanks for watching, and if you have any questions for me, put them in the comments. Happy to answer anything that I can answer, because I'm making these videos to help people like me that are, worried about surgery and recovery. So thanks for watching. Bye.